The role of urodynamics in pudendal neuralgia. My name is Luis López-Fando, functional urology from Spain. These are my disclosures in relation to this abstract. Pudendal neuralgia is a neuropathy of the pudendal nerve that is often misdiagnosed and inappropriately treated. It causes chronic neuropathic pelvic pain and can affect both genders, but the prevalence is higher in females. Pelvic pain may be accompanied by other symptoms like bladder, bowel, and sexual dysfunctions can occur. The incidence of urinary symptoms among patients diagnosed with pudendal neuralgia has not been sufficiently explored yet, as well as the role of urodynamic testing is not also sufficiently explored. Lower urinary tracts are commonly associated with pudendal neuropathy. Urgency, frequency, and slowing of the stream can be associated with pudendal neuralgia. Urodynamic investigation is the gold standard method to assess neurogenic lower urinary tract dysfunction. However, has not been recommended in all patients when considering the diagnosis of pudendal neuropathy. There are no studies so far that have clearly analyzed the need to perform urodynamic investigation as a mandatory baseline diagnostic intervention in this kind of patients. The aim of this study was to analyze the role of urodynamic testing in the evaluation of pudendal neuralgia and to describe the frequency of urinary symptoms and the urodynamic findings in patient diagnosis with this entity. 52 patients with diagnosis of pudendal neuralgia on the basis of Nantes criteria were included in this study. The evaluation of patients included medical history and physical examination, included skin rolling test and compression of nerve to reproduce pain. A visual analog scale score is also used, and neurophysiological test is always performed, consisted in bilateral pudendal somatosensory evoked potentials and electromyogram and bulbo-cavernous reflex testing. To evaluate lower urinary tract symptoms, we always perform bladder diary and urodynamic investigations, including feeling cystometry and pressure flow studies of voiding. All analyses were conducted using STATA version 14. 45 out of 52 patients were women. The mean age was 51 years old, and 9 cases had bilateral pudendal neuralgia. Imaging study only demonstrated the treatment of the pudendal nerve in 5 cases with computed tomography and in 3 cases with magnetic resonance imaging studies. The neurophysiological test was diagnostic in 30 of the patients' studies of the study. Urinary symptoms was the most frequent minor diagnostic Nantes criteria associated symptoms in 61 patients, especially urgency in close to 40% of the patients. Other associated symptoms were burning and rectal or vaginal foreign body sensation. Urodynamic test was performed in 46 patients. Overall, 35 of the patients had abnormal findings of their urodynamic test. Although storage lower urinary symptoms are more prevalent than voiding or micturition symptoms among pudendal patients, the most common urodynamic findings are voiding dysfunctions. 75 of patients with pudendal neuralgia have urinary symptoms, urodynamic findings, or both, as we can see in this figure. Pathological urodynamics results is not associated with prior factors including patient-reported urinary, sexual or bowel symptoms, age, positive response to CT-guided nerve block, or diagnostic neurophysiological testing. So, we can interpret of these results that urodynamic testing provides objective measures of the function of lower urinary tract in this kind of patients. 3 in 4 patients with pudendal neuralgia have urinary symptoms, urodynamic findings, or both. With this data, we can assess that bladder diary and urodynamics are important tools in the assess of generators of chronic pelvic pain. As conclusion, we can affirm that urinary symptoms must be also considered a fundamental or main aspect of evaluation of patients with pudendal neuralgia. Due to the high incidence of bladder dysfunction among these patients, urodynamic tests can help to screen this condition and should be performed in all patient diagnoses with pudendal neuralgia.
Cuando termines igual tienes
He metido la pata.